All right. Good morning, everyone. Today we are going to be talking about our policies and procedures, which should not be new to anybody here. This is just kind of like a refresher for everyone. All right, so policies and procedures. So, MedSide is a private home care provider licensed by the Georgia Department of Community Health, which means that we must follow the DCH licensure rules and regulations in order to offer services to the public. If the rules are not followed, then our license can be revoked. MedSide is also enrolled in the Elderly and Disabled Waiver Program, CCSP and Source, to provide a range of supportive services in the member's home setting under Medicaid. Now, we must follow Medicaid rules and regulations to get paid for these services. And again, if rules are not followed, the payment for services can be recouped retrospectively. Personal support aides provide services, and a registered nurse or a licensed practical nurse, under the supervision of an RN, provides medical supervision of the personal support service aides. All right, so a refresher on some MedSide policies. Sexual harassment. MedSide does not tolerate harassment of employees by anyone, including supervisors, coworkers, or clients. Employees should immediately notify their supervisor or HR if they feel like they have been subjected to sexual harassment. Smoke free workplace. MedSide is a smoke free work environment, and no smoking, and I mean absolutely no smoking, is allowed with or without the client's permission. Drug and alcohol free workplace. Again, do not report to work under the influence of alcohol or illegal substances or consume alcohol or illegal substances while at work. We are an absolute drug and alcohol free workplace. Okay, so attendance and punctuality. Our ability to carry out our mission is very dependent upon our employees being at work assignments on time as scheduled. So, reporting to work as scheduled and on time is the responsibility of each employee. Each occurrence of absentees will be documented in the employee's file. Now, if you can't be at work at the scheduled time, you must notify your supervisor immediately. You must call the office and do not call the client directly. Now, if you don't call the office, that is considered a no call, no show, and we have absolutely zero tolerance for that action, which is grounds for immediate termination. Now, your attitude. We always like to say your attitude and your behavior are just as crucial as your skills, because if you walk in and you're having an absolute bad day and you knock on the door and you're getting ready to start your shift and your client notices that you're in a bad mood, that can really make or break the entire shift. So your attitude and behavior are very, very, very crucial. So working for MedSide requires cooperation amongst the MedSide office, field staff, client, and the client's family and other clinical personnel taking care of the client. We definitely strive to make sure that each of our employees are friendly and professional with our clients. And to help with this goal, please make sure you are doing the following. Please be respectful of their time and arrive on time. Please follow their care plan and be attentive to the client's needs. All right, so our medication policy. Remember, only licensed clinical personnel may administer medication under a physician's orders. So non-licensed clinical personnel, which is you guys, CNAs and PCAs, may not directly administer medication to the client. Now, they may assist clients with taking their medications by any of the following: reminding the client it is time to take the medication, reading to the client the correct dosage and frequency from the label, and opening the container at the client's request. Again, you may not decide how much medication to give or what time it should be given. This includes pre-filling weekly medication boxes. Performance evaluations. So, when it comes to disciplinary actions, there should be any indication that you are not meeting the job expectations regarding performance and/or conduct, you may be counseled. So some steps in disciplinary action include verbal counseling, the first and second written warning, a final warning, and if you're still continuing to do what you shouldn't be doing, you will get suspended. And then after suspension period, if we find out that you're still not exceeding the needs or meeting the needs of MedSide, you will be terminated. And some examples that will include you being written up would be falsifying forms, reports, medical records, employee timesheets, or the client's signature, doing no call, no show, driving a client or his or her family members in either the client or the employee's car without prior authorization. Remember, you guys, it is okay for you guys to drive them, but you need to reach out to HR and transportation, and you need to get that prior authorization. Smoking in prohibited areas and making adjustments to your work schedule without permission. All right, so emergency situations. What actually constitutes as an emergency? So, one, you cannot go see your client at your scheduled time or you're going to be more than 15 minutes late. Your client experiences an incident such as a fall, a burn, a cut, scratch, any abnormal vital signs, or changes in mental status. Your relief is more than 15 minutes late. You have a question about their care plan, or you need to report a requested change in schedule or services by the client. All of that does constitute as an emergency. What is not an emergency is, let's say you just joined Medside, you got your first paycheck, and you remember putting your taxes, signing your taxes as a certain way. And you look on your pay stub and it's not that certain way. Yes, we do take your money very seriously, but the person that we do have on call after hours does not have any access to your personal file or any HR or payroll related incidents. So if it's anything payroll related or personal related issue, that will have to wait until Monday morning. Okay, so when handling client emergencies, when there happens to be an emergency where you might need to call 911, it is very important to follow this chart. So first off, when in doubt, call the office. If you have an emergency and you just don't know what to do, you're flustered, you're stressed, just call the office and we'll work with you and we'll walk you through it. So first, you want to ask, is the client conscious? Is he or she alert and oriented? So if no, then yes, you're going to call 911. You're going to wait for help. And then after that has happened, you're going to immediately report the incident to the office. Now, on the other hand, is the client conscious? Is he or she alert and oriented? Yes. So if they are conscious and oriented, you are going to want to ask them for their permission to call 911, because remember, the client has a right to refuse to allow you to call 911, but he or she does not have the right to refuse to allow you to report it to the office. So either situation, it needs to be reported to the office. Okay, so let's say that client does not give you permission. So what you're going to do is you're just going to report it to the office and that's it. If they do give you permission, then you're going to do the same as the no situation. You're going to call 911, wait for help, and then after that, you're going to report the incident to the office. All right, so the fun stuff. When it comes to your money, payroll policy, and procedures. So your work schedule is available online. It's at medside.com. It is managed by your care coordinator, and you must follow your schedule as assigned, you guys. We and the coordinators make your schedule based on your availability. So if you're unable to see a client at the time you're assigned, you must contact your care coordinator immediately. All right, so submitting documentation for pay. So Medside is mandated by the federal government to use what we call the EVV, which is the electronic visit verification. Employees will complete and submit documentation verifying the time, the task performed, and the location of the visit via the electronic online system at the client's home. So there is this quick video right here, and it is a video on how to complete the documentation for the visit. As of right now, we're not going to go fully into that, but just know that it is found on our Medside website. So what you're going to do is you're just going to go to medside.com. You're going to find the employees tab, click that, and then I believe under Employee Education Center, you're going to see something along the lines of viewing my schedule / signing in and out. That is the video that you're going to watch if you are unsure how to task something, how to document anything, and just how to sign in and out. All right, so the PCA should start and finish the visit at the scheduled time and location, and the client must sign at the end of each visit, confirming each delivery. So if the client's signature is missing, what will happen? So the visit won't be processed for payroll until both the employee and a client contacts the office. So the employee should call the office and provide a brief explanation of the reason the visit was not electronically verified and let the client speak to the care coordinator. If the care coordinator for some reason is not available, the employee should leave a message with the following information: the exact time this visit started and finished, and you also want to let the client confirm it during the message, a description of the encountered technical issue if that was the case, and then a callback number. All right, you guys, this should not be anything new, but PCA services are only permitted when the client is present. I will say that again. PCA services are only permitted when the client is present. No services can be provided to an absent client, okay? So any client incidents, including falls, emergency room visits, hospitalizations, etc., must be promptly reported to the office. So if the client has been hospitalized, all PSS visits are on hold until the client is discharged. Do not visit the client in the hospital, you guys. There are Medicare and Medicaid rules that say that they will only pay for one location. So if you go visit at the hospital, that's their home location plus the hospital location, which they will not pay for, you guys. So if this happens, do not, and I mean, don't listen to the client. If they want you to go to their house to do some chores, but they're not there, you will not be paid for those services. All right. And I believe that's actually all that we have for you guys today. So I appreciate you guys tuning in and just listening to, like I said, nothing new, but just listening to a brief debriefing. Thank you guys.